Hello, good afternoon, and welcome everyone to our webinar in recognition of National Minority Health Month. Today's topic of conversation is vaccine ready, and we will be speaking with University of Chicago medicine physician Dr. Arshiya Baig. Just a few reminders for those of you who are joining us here live on our Zoom. Please make sure you're muted when you're not speaking. We are streaming this live to Facebook, and we'll also be recording this and sharing this video to our YouTube page. If you have any questions throughout today's presentation or conversation, you can use the chat box function. This is also more conversational, so if you have a question, you can also feel free to unmute yourself and ask a question if you have it. For those of you who are watching on Facebook Live, you can use the comments feature on Facebook to ask any questions that may come up. Today's webinar is brought to you by the University of Chicago Comprehensive Cancer Center, Office of Community Engagement and Cancer Health Equity. My name is Aaliyah Poulos, and I'm an education outreach specialist in this office. I'm joined today by my colleagues, Gina Curry, who is our Director for Community Outreach and Engagement, and Erica Rodriguez, our Latinx outreach specialist. And our office really serves to be this bridge between the communities that we serve, whether that's within the University of Chicago or the larger Chicagoland area, and the cancer researchers and clinical faculty at the University of Chicago. And our goal is to bring health and cancer education to as many people as we can reach. So thank you all for joining us for our programming today. As I mentioned, today's webinar is in recognition of National Minority Health Month. So the month of April is designated as National Minority Health Month, and it was established in 2010 by the Department of Health and Human Services. And each year there is a theme to National Minority Health Month. So this year's theme is vaccine ready, talking, of course, about the COVID-19 vaccine and looking at it through the lens of minority health. So we are so grateful today to have Dr. Baig speak to us on this topic. So Dr. Arshiya Baig is a physician at the University of Chicago Medicine, specializing in internal medicine and primary care. She's an associate professor of medicine, and her research interests are community health and health disparities, particularly within the Latinx community. So we want to welcome Dr. Baig today, and I'm going to stop sharing my screen and throw it over to her. She'll give us some great information, and we will also, my colleague Erica and I will be asking her some questions, and if anyone else has questions as we go along, as I mentioned, feel free to use those comment features, or if you're joining us on Zoom, you can ask directly. So Dr. Baig, I'm going to stop sharing my screen, and welcome and thank you for joining us today.
Wonderful. Thank you so much for having me. I'm really happy to be here and to sort of share some of my experiences and my thoughts. It's been a long year for all of us, and especially as a primary care doctor and as a researcher, thinking about disparities, resource allocation, and especially, now this bridge with the Cancer Center. I'm really happy to be here today. What I may do, I have just a few slides, maybe just to give a little bit of background of the things that I've been thinking of, some of the data that I have been curating that is publicly available, and then let's have a conversation. So let me just share my screen, and we'll just talk a little bit about some of the background here. So, and this is just to be orienting everyone here. So most of my work has been Latinx disparities, and gosh, I've been at the university for over 12 years now, and my research has been mostly focused actually on diabetes and Latinx health disparities, but really broadly thinking about how to improve patient outcomes. So first of all, the U.S. Hispanic population, it is growing. Currently, it's about 16% of the U.S. population. The estimates are that it's going to be about 30% of the U.S. population by about 2030. And right now there are about 61 million Hispanics living in the US. So how does this relate to Chicago? Well, in Chicago, actually 1/3 of our population is Hispanic. And here, I always like to show these maps because we see the distribution, right? So we have pockets of Latinx communities here in the Southwest side, the Northwest side. And actually, we don't have the suburbs here, but there's a growing Latinx population in the city as well, or in the suburbs as well. So here we see where the concentration is. And I'll come back to this map. It's always a good orienting map. So economic hardship. So the Rockefeller Institute and the University of Illinois Chicago have looked at these 6 variables and combine them into this economic hardship score. And they look at unemployment, education, per capita income, poverty, crowded housing. Although I don't know if I like that term. To me, that's just multi-generational housing potentially, right? And then dependency. And here we see, so the darker areas, the darker red, just higher economic hardship. I have this circle here, and that actually just shows the community that I've been mostly doing research in Little Village, which sadly has been in the news recently. I've been working in this community for the past decade addressing diabetes disparities, and you'll see that they're at the darkest range, right, for economic hardship as well. So the Chicago Department of Public Health is a great source, actually, and also the Illinois Department of Public Health, for maps of COVID cases, of vaccination rates. Granted, some of the maps and such are changing, so what I had available to me about a year ago is a little bit different now. That's why this map is a little bit older. But again, looking at that Chicago map, we're seeing where are the deaths from COVID happening? And again, we see them in the Northwest side, the Southwest side, and also the South side. And when we look at age-adjusted mortality from COVID, we see this huge spike for Latinx. And this is data up to November, which we know from the beginning of the pandemic, up until November, this is what was happening. And from the data that I can see, they don't have a map. I don't think too much has changed in terms of the overall rates. And then when we look at positivity among Hispanics, we test positivity. So these are the folks who had a test and the percent that were positive, also just higher among Hispanics, and throughout the pandemic, really up until this graph goes until January. And you'll see even initially, the rates of positivity were like up to 60% in some communities, in Hispanic communities. So, okay, so we have an idea of what was happening in terms of COVID rates. And, we do know that the case rate and mortality is higher among Black and Brown communities. And then Kaiser Family Foundation did this survey, and this is, again, a few months old, to really assess, well, what about uptake of the vaccine? And here we see that 7 in 10 Hispanic adults in the US said that they'll get the COVID-19 vaccine. And that rate is just a little bit lower in Black communities. And, to me, when 70% of a community says that they want to take something, to me, that is not hesitancy. And then if we look a little bit further, we tend to group all Hispanics into one pot, but when we disaggregate and actually look at by age group, so 18 to 49, 50 plus, and then essential workers, we do see that there are some differences, right? So it seems that the folks who are a little bit older, 50 plus, maybe are more likely to get the vaccine, at least per this polling. Maybe younger adults, less likely. And then essential workers, I would say, are fairly interested in getting it. Again, if we look at this 50% mark, I mean, everyone is over this 50% mark. So what is actually happening with vaccines? So this is data from back in January. And back then, you'll see, so again, looking at this map of Chicago, that who is getting the vaccine? Well, a lot of people on the north side. Now, one can say, well, that was probably because during that phase, it was mostly healthcare workers, right, who were getting the vaccine. And then I was just able to pull the map again for today, from today, and we'll see still again that north side of the city with higher vaccination rates, but then we're seeing some more blue shading here in the northwest and southwest sides. Still south side, I would say, lagging behind. So what can we do about that? In terms of, I think this also again comes from the Kaiser Family Foundation. Well, where are folks getting their information? And most people, so at least among Hispanics, are getting their information from their own doctors, right? CDC, local public health departments, and then we see, who they are really not going to. There is a difference among adults by age. One can say potentially it could be because younger folks are maybe not as engaged with the primary care doctor if they don't have any medical problems. So there we go. And I will say, I think that the city has put a lot of effort into vaccination and thinking about equity. They've had a task force thinking about vaccine allocation. So I do think the city and the state are thinking about how best to allocate what was a scarce resource. Now we're seeing that we're actually, the supply is increased. So those are just some slides I thought that I would sort of give some background on to maybe help frame our conversation.
Yeah, thank you so much for providing that information. That was really good data, helps to kind of paint a picture of where we are right now in Chicago. And of course, we started vaccinating people late December, early January for our healthcare workers and most of our essential workers. And now we're in April at a point where basically everyone who can get a vaccine is now eligible to get one. So, or everyone who wants a vaccine is eligible to get one. So we've come quite a long way in just a few short months here. So I guess my first question that I wanted to ask, we hear people say, well, what does it matter if I don't care about it? What does it matter if I get the vaccine or not? And can you just sort of explain the importance of the vaccine and the role of the COVID vaccine when we talk about like at the community level and reaching herd immunity, both, in our communities, in our city, as a country, the big picture role of the vaccine for herd immunity?
Yeah, that's a great question. So the vaccine is probably our strongest tool against this pandemic. That's what I would say. Masking, social distancing, yes, those are important also. Getting the vaccine not only protects the person getting the vaccine, but also the people around us, our friends, family, coworkers, patients, clients. So we're not only protecting ourselves, but also others. I think that the closer we get to herd immunity, that means there'll be less virus circulating, right? Less people getting it, giving it, contracting it. I think it allows us to go back to school, open up our businesses, start seeing our family and friends. And what we're seeing with these mutations of the viruses mutate. We know that. The way that they mutate is they want to get stronger and continue circulating in our country and in the world. And the fewer people we have vaccinated, the more likely it's going to continue to mutate, to become stronger, more infect people more easily. So if we can get vaccinated and decrease the amount of virus that's circulating, I think that's going to help our health and our economy, and even thinking about global equity, really.
Yeah, I think that's a really, really important point that you brought up here, because I think there are people that look at it, not necessarily maliciously, but they sort of look at it through the lens of themselves. Well, I'm not worried about COVID, so what's the big deal if I get the vaccine or not? And really, it is something we should be thinking about on a community and macro level to try to reach herd immunity. And when we talk about herd immunity, do we know exactly what a rough percentage is about how many people we think we need to reach herd immunity? I know that this is continuing to be studied and looked at.
Well, I'll probably just quote Dr. Anthony Fauci. What he has been saying is
always a good idea.
Yeah, he's the expert here, and what I've heard from him is 70 to 80% of people should need to be vaccinated for us to reach herd immunity. Yeah.
So quite a bit to go still.
Yeah, and I would say just last week we were hearing in the news, I think, is it like half of Illinoisans or half of Americans have gotten one, or adults have gotten one shot. We're getting there. I'm a very hopeful person, so we're getting there. We just need to get people to get that second shot if indicated. So they're fully vaccinated.
Right.
So true. So Dr. Baig, why is it especially important for minorities to get vaccinated?
Sure, that's another great question. So I've shown the maps, right? I think that, so we can think about it in different lenses. So some of it is economic, right? So like at least in the Latinx community, there are many essential workers who are Latinx, right? They are working in transportation at grocery stores, and, so they need to maybe keep working because we do know, just looking at demographic surveys, there is less like paid time off for folks, right? So I think that vaccinating the people who are our essential workers who are needing to go out there and work and really keep our economy moving is really important. So there's that. I think that, at least in Latinx communities, high rates of diabetes, hypertension, obesity. So there may be more complications from COVID. So I think prioritizing, these communities is actually also important. I mean, just looking at the mortality rates, I mean, they're staggering. So I think multiple reasons for focusing in on these communities. Yeah.
Okay.
So there's a question in the chat box here. So Erica and I have some questions that we're going to be asking Dr. Baig, but again, if anyone else has questions as we go along, feel free to type them in the chat box. If you're joining us on Facebook, use the comments feature on Facebook, and I'm going to intersperse those questions as we go along here. So there is a question in the chat box asking, is there any update that we know about on whether or not the vaccines can stop the spread of asymptomatic COVID-19?
That's a great question. And again, I am not an infectious disease specialist. So a lot of what I'm hearing and reading is what our specialists and what we're hearing from the CDC. I mean, I know that they have loosened the guidelines and this is probably this is based on evidence, right? So now like older adults, like grandparents can now be with children, let's say, who are at low risk of COVID, although we know that they have not been vaccinated. Now, again, this is sort of based on like what we're seeing, even, bringing households together, as long as the adults are vaccinated, not large gatherings in public with many people who are unvaccinated. So, I think that we're probably getting data that there is less maybe asymptomatic spread. But I think the tension is that we also as a society want our older adults to be interacting with low risk people once they're vaccinated. So I would say I don't have the answer to that. And I'm not sure if anyone really does. I think we're slowly loosening the guidelines so we can get back to some normalcy, knowing that once you're vaccinated, the likelihood of getting COVID and spreading COVID is low, but again, the vaccines are not 100%, right? So that's probably my best answer. Yeah.
So, you touched on this a little bit. We know about, you touched on vaccine hesitancy, and I think there's a perception that that our minority communities, our Black and Brown communities, are more hesitant to getting the vaccine, although you showed some data that maybe dispelled that. And I guess, what do we know at this point about who's most resistant to getting vaccinated?
Mm-hmm. Well, yeah, I do want to dispel this idea that the main cause of disparate vaccination rates is hesitancy, like the Kaiser data that I showed. I think a lot of it is just the equity and distribution and access. I think that is what we're seeing. I think that same Kaiser survey showed that I think it was 50% of white male Republicans were hesitant. So one can take that and, interpret it. But I think what we're seeing overall in Black and Brown communities is that it's the equity and distribution inequity that's causing this disparate rate of vaccinations.
So not necessarily hesitancy, but just access and being able to get the shots in the arms, so to speak.
Yeah.
Yes. So what are the top concerns that you hear from minority patients regarding the COVID-19 vaccine? What are some of their concerns?
Yeah, I think some folks think that, was the process rushed, right? Was the science rushed? And I would say, no, the science for mRNA vaccines has been around for decades. I think that the speed at which we were able to develop a vaccine notes is based on decades of science, and it actually shows just how much stronger we are scientifically in our country right now, right? Or in the world, really, that we're able to take technology that has been studied, we're able to develop a vaccine, but then safely test it, go through all the federal guidelines in terms of how many people need to be tested, what the time points are, you know, and as a researcher, like I know, like we need to calculate out how many patients we need to make sure it's safe and efficacious. So I think, you know, all the vaccines that have been approved so far have gone through those phases of testing and hasn't necessarily been rushed. I think some people are like, well, I'll wait for other people to get it and then I'll get it. And I will say, well, at this point, millions of people in the US and the world have already received the vaccine. I think that time is of the essence in terms of getting vaccinated to really stop this pandemic and to decrease the amount of variants that are circulating and the mutations. So I think those are the main comments I've heard.
Okay.
I actually wanted to share, for those of you who are joining us on Zoom, I'm actually going to share an article in the chat. So I like that you brought up the fact that the mRNA technology has actually been around for quite a bit, even though they're using it in vaccines now. And it was wanted to share just a great piece from the New York Times, came out a couple of weeks ago about the scientists that helped to develop the mRNA technology. They just had a really great human interest piece about her and just her work and how she just sort of pursued it tirelessly for, as you said, decades. She wasn't the only one, but she was one of the main scientists who did that, and she's finally seeing, you know, the fruits of that research. So that's just a nice piece there. And for those of you who are joining us on Facebook, I will drop that into the comments box as well. Just I really liked that article. That just jogged my memory of it. So, you know, we talked about, you know, is there vaccine hesitancy, or what are some of the reasons why we see disparate vaccination rates among minority communities? And so what are, you know, if we said that it's probably not quite hesitancy, but more an issue of access and distribution. So can you just discuss a little bit what are some of those barriers to equitable access and distribution for the vaccine, and what can we do to overcome them?
Mm-hmm. Yeah, well, number one was just the resource, the vaccine. We just didn't have enough, right? I mean, that was the problem initially. So we had to figure out how to distribute it within the city, within the state, even within within the University of Chicago medicine, right? How do we distribute it to our patients? So there's that. I think some of the barriers, and actually we have great people from the University of Chicago who have written about this as well and have been published in the lay press and also in academic articles, that some of it's technology. So if we're saying that you can only get a vaccine by getting online and registering for an account and doing all that stuff to get an appointment, well, you know, not everyone has access to that technology, right? Not everyone has a computer at home or Wi-Fi at home. And then you go through all that and then there's no appointment at the end of it, right? So there's that piece. I think language access initially was a concern. I think things are improving. So if you're not an English speaker, are these websites available in in other languages? So there's that piece. There weren't drop-in sites now I've heard a little bit about like walk-in sites now that I think the vaccines are more available. But before you had to make an appointment, and who knows when that appointment was going to be, and could you get time off of work to make that appointment and such. And then also where were the vaccines being given? There are lots of like pop-up events, but no standing locations, right? You couldn't just like walk in. You'd have to kind of be in the know as to when and where these things were happening, these events, which is a challenge, right? If you're not very connected and online and in these social networks. So I think so a lot of it was like down to technology and like just, health literacy in terms of technology use, and then just where the vaccines and how they were being given.
One thing I wanted to note, you talked about just getting people to you know the barriers of technology, and what if you don't have that, or what if you can't physically get someone to a vaccination site. And I just wanted to share with the group, and again, for those of you who are on Facebook, I will drop all these links in our Facebook comments as well. But is the Chicago Department of Public Health does have a homebound vaccine program for anyone who's just for whom transportation, if they're elderly, they can't get out of the house, for anyone for whom that will be a barrier. So I just wanted to drop that link in the chat box, just so that people have access to it.
Yes, and thank you for sharing, Aaliyah, because I have a family member that they did stop by and they did it for her. She has dementia, and that was wonderful. It was definitely a relief for her caretaker. So the next question is, what can healthcare workers and everyday people do to try to combat vaccine hesitancy? And what are the best ways to educate communities on the importance of the vaccine?
Yeah, these are great questions. I mean, even so, I think what we can do as healthcare workers is just talk about getting the vaccine, right? I am talking to my patients when I see them, like, "Hey, are you thinking about getting the vaccine, or why not?" And then I share my experience, like, "Oh yeah, like I got mine, and this is how it went, or or this is how my patients are feeling after getting it," and just letting them know like how I feel, like a little bit more safeguarded from getting the infection, and just how I feel about it, and why, and what my motivations were, right? Like, I want my mother to see my child, so I share my personal experiences with my patients. And I think as healthcare workers, we can do that. And, and really anyone, all the way from front desk staff to the MA who is rooming the patient, to the physician, to the nurse practitioner, that, I think we can share our experiences. And even actually in our primary care clinic, we have photos of all our physicians and staff who've gotten the vaccine. And we wrote out like what motivated us to get the vaccine. And all of us had a reason, right? Some were overlapping, but some were unique. And so I think sharing is probably the most important. And I think in terms of community, I think providing information that is culturally sensitive and in the language of the community is really important. And not just saying, well, you should get it, but also this is how you get the vaccine, right? And I think just really talking about the benefits, like not just to the self, but the family, the social network, the community, the economy, right? If you want to go even further out. Yeah,
that's true. Yeah.
I have a question that came in here asking about. So there was an article recently asking about, or talking about rather, how a lot of people are maybe skipping their second dose if they're getting the Moderna or Pfizer vaccine. Some of it is not intentional. Some of it is, accidentally missing their appointment, or they got it during a time when the supply was more limited, so they couldn't find a matching dose. Maybe they got Moderna for their first dose and couldn't find another Moderna or Pfizer. But there were people who said, well, I feel like I'm immune enough after one dose, and maybe we're worried about the side effects of the second dose, since that gets talked about a lot. So do you want to just speak on that? What is, I think a lot of us on here probably know this, but maybe you could just share why people need to get both doses.
Yeah. So no, this is a great question. And, and life happens, and I understand that, right? I mean, how often have we had to cancel an appointment or not be able to make it to, even to get a haircut or whatever it is, right? So it happens. I think that, so I would say for those folks, try to reschedule as soon as you can, right? The supply is increasing, so hopefully that won't be too much of an issue now. So the supply of the vaccines. I would say that the studies were done to, and what they showed was that, yeah, there was some efficacy right after the first dose, but there was usually a bump after the second dose and 2 weeks after the second dose. So I think, if you can increase the coverage of not getting COVID from like 80 to 90 something percent just by getting a second dose, just do it. I think that in terms of side effects, or people are worried about it, talk to your doctor about it. See what are the expectations for you. Most side effects after the second vaccine are fairly mild, but I can say it's probably better than getting COVID eventually.
Yep. Absolutely. We hear that a lot for people that have had side effects. Some of us on here may have even gotten the vaccine. And I think a lot of people think, oh, I'm definitely going to have side effects. And I'm here to tell you too, that a lot of people I knew anticipated getting side effects, and then nothing happened. And then some people got some mild ones, and it really varies. And it's certainly, one day of some side effects is certainly better than all the risks associated with contracting COVID-19. So that's really important to keep in mind, right? That's a really, a pretty significant trade-off, I think. And so I wanted to turn now and ask you about the state of the vaccine globally, and just asking about what does global vaccine access look like, and what are some steps that the U.S. can take, and I guess I'm talking about in terms of policy here, to ensure that the vaccine is that there's equitable access globally, and that our people abroad are able to get the vaccine as easily as we've been able to get it here in the U.S.
Yeah. I think this pandemic has made us realize that we live in a global community. And this is a pandemic. This is not just an epidemic that is isolated to a region or a country. This is a pandemic. It's global. So what's happening in other parts of the world is going to impact us. We've already seen some of the variants here in the US. Maybe there are variants even here, but we're finding that they're in Britain, they're in Brazil, wherever they are, that they're showing up here as well. So this is clearly a global issue. I know that in India, we've seen a lot on the news in terms of the pandemic there, the case rates and hospitals at capacity, lack of oxygen. This is all very distressing. I mean, we really are a global community. And I think that, and just from the news, hearing that maybe the US has a surplus of vaccines, I think that thinking about how we, as a member of the global community, can help our peers, our other countries in battling COVID is important. I want to say our federal government is taking steps towards this. But again, I only hear what you all hear from the news. But I would say supporting global equity in vaccination is actually really key, because not only does it impact other people in our global community, but eventually us as well. So, I mean, as the US, I think, has done a good job in getting getting Americans vaccinated, but I do think that we need to have a global perspective.
Yeah, I definitely agree. We hear a lot about, you mentioned India, and I think we are short-sighted, first of all, to only think of ourselves as one isolated country in a world of 200 and something countries, and also this idea that health is global. And this is something too, we look at even states right now that are like Michigan that are having some surge in cases, and as much as we want to be, think about this in a humanitarian way in general, it also will affect us eventually, right? These cases don't stay isolated, and like you said, it does. Even if you take out the humanitarian aspect of it, there is still a self-interest in eradicating COVID, both domestically and globally. And so I think it's really short-sighted to think of just the U.S., especially when we do have so many vaccines. And I think another discussion that's being talked about now is and this is again sort of I'm not going to delve too much into politics, but from a policy standpoint, what can the government do to provide patent waivers so that other countries can begin developing the vaccine on their own? So I think these are conversations that are really important and that people should be having. And I hope that our leaders at the upper echelons of government are having them as well. And you hope that they are, and seeing this again from this community and global perspective.
Yeah.
So those are all the questions that I have, and I'm going to invite anyone that has any questions. Few different options. So for those of you on Facebook Live, unfortunately, your only option is going to be to use that comments box. So please type any questions that you have into that comments box. For those of you who are joining us on Zoom, a couple options that you have. You can either message the group directly using the chat box function. If you want a little more anonymity, you can direct message myself or Erica or Dr. Baig and ask the question, and we'll ask it on your behalf, but anonymously without using your name. Or you can just unmute yourself and ask a question if you've got it. So we're going to open up the floor now to any questions that people may have on this topic. I'm going to check our Facebook as well, just to make sure that none are coming in through the comments.
And what I will say, I think while we're waiting for questions to come in, I am really pleased by our institution, the University of Chicago Medicine, and the way that it has distributed vaccines. I think, they brought a committee together of infectious disease doctors, ethicists, health disparities researchers, administration of the hospital, and really thinking about how do we best allocate this resource, and we started with healthcare workers that were, back in December, January, and then quickly we rolled it out to those over the age of 65 through a lottery system within our catchment area, then extending beyond, and then, and I felt like, and I've heard from my patients too, that they've been very happy with the way that, they would see me in clinic and I'd be like, yeah, I think, you should be getting an alert. And literally some of my patients, the next day they got an alert for an appointment, So I will say I'm proud of our institution. And for many of you maybe who have received a vaccine through the University of Chicago, even the clinic was so well run. I feel like it was really efficient. Always brings a smile to my face when I'm walking from clinic back to my office and I see a bunch of folks lined up to get their vaccine, and even our waiting area. So I think for all of us who work at the University of Chicago, I think we should be proud of the way that we have vaccinated our community of staff and providers, and then our patients.
Yeah, I totally agree. Totally agree. Got a question here. It says, for vaccines that lessen the severity of the illness, but aren't necessarily providing immunity, is it really helping the pandemic if people can still spread the disease?
That's a great question. I think that, so the vaccines so far, I think from what I have read, they decrease mortality and severe disease and hospitalizations. So what I would say is that even if someone, so if you have a mild case, right, you can infect others, but you probably don't need to be hospitalized. You probably don't have to go to the emergency room. You can probably stay isolated at home. So, just the act of maybe of getting it, but then staying isolated at home will decrease the stress on the healthcare system. So then now we can take care of the folks who are getting very sick and need hospital level care. That's an excellent question. Yeah, a lot of it's the strain on the system. And, and I would say when there's strain on the system from COVID, we still have our patients with diabetes, with strokes, with heart attacks, with cancer complications. Those folks still need to get care, even if it's not COVID related, and, I think just seeing what we're seeing in India as well, in terms of hospitals being overrun and oxygen running out. If folks were vaccinated at a higher rate, perhaps, and they had milder disease, they could maybe just stay at home and recuperate and recover. But great question.
Mhm. So I understand that, like, if you get a flu shot, you're expected to get it every year. And when you have you're a baby, they give you a set of vaccines. Now, when it comes to the COVID vaccine, how often are we expected to get it? Are we going to be doing this every 6 months, every year?
Mhm.
Um, is it, and will it be the same for the Moderna, the Pfizer, and the J&J?
Yeah, great question, Erica. I think that we're still trying to figure this out. I think the longer we have the test subjects like through Pfizer and Moderna, those participants, they're monitoring them, are continuing to, and I think we're going to have that answer hopefully soon. I just saw something from the Pfizer CEO thinking that likely it may become an annual vaccination, but I think we just don't have the data yet, you know.
Okay.
But I think that's a great question. I think we all, as primary care physicians, as patients, as community members, are wondering that. I would not be surprised if it becomes an annual vaccination, but I think that's the next question, let's say, that we need to
Mhm.
answer with the data.
I guess we could hope that's the case, because we wouldn't want all of us to have to do this again in 6 months. Imagine if we were doing this every 6 months, it's going to be really tough. So let's
Yeah.
just keep our fingers crossed, I guess.
Yes.
Absolutely. And I think, um, yeah, so just two things that keep sticking in my mind whenever we talk about COVID. One is that still learning a lot. Everything that we're doing is being studied in real time, and we're still figuring out some of those hard answers and some of those difficult questions. And the second is just this idea of how inextricably linked we are, and when it comes to public health in general, right? The idea that the amount of COVID in your community could affect how quickly you're able to get seen if you break your arm, at your local emergency room, and just again, this idea that both within our smaller communities in Chicago and in our catchment area, in the state, in the country, and globally, like there is no unlinking us all. There's no disconnecting. Everyone is linked when it comes to public health. And so anytime we look at COVID through this really personal lens, I think it becomes really futile, because it is such a community driven, as most diseases are, as a lot of diseases are, I shouldn't say most, but as this one is, certainly a community driven. We have to be looking at this through a community driven lens, that everything we do in regard to our own safety for COVID is also for the benefit of others.
Mhm.
Um, so I'm going to check one more time to see if we've got any questions coming in on Facebook or on our chat here. Again, if you have any questions for Dr. Baig, unmute yourself on Zoom, place them in the chat, or if you're joining us on Facebook Live, drop them in the comments box. Um, and as I look, Dr. Baig, I'm just going to ask you to what are just a couple takeaways, some big picture things that you'd like to leave people with today when we're talking about the COVID vaccine?
First, I'll say get your vaccine. If you haven't gotten it, get it. If you got your first shot and you need a second shot, get it. Talk to your friends and family about it. Let them know what your personal experience has been, how you feel after getting it. Do you feel a sense of relief? If you want to share if you got side effects, sure. Maybe it'll alleviate some people's fears. Reach out to folks who maybe need some assistance, right? Your neighbor, do they need help making an appointment, making a phone call, getting online? See how you can help others in your community. I think that the supply of vaccines is increasing. So hopefully these appointments will be easier to come by. I'm hopeful for that. I would say still try to avoid big gatherings indoors, do social distancing and masks, if you're with people outside of your household, and just try to keep updated as you can. The CDC guidelines keep changing, improving, and just as I do, trying to keep abreast of what the recent guidelines are. So yeah.
Great. Thank you so much, Dr. Baig, for joining us today and sharing your wisdom and knowledge, and having this really important conversation with us.
Thank you so much for having me today.